CGTN, China Global Television Network.
This week, the world commemorated the World AIDS Day, an international day set aside for people around the world to unite and show support for people living with HIV while remembering those who have died from AIDS-related illnesses. The theme for this year's commemoration is Global Solidarity, Shared Responsibility, a theme that is especially significant at a time when the COVID-19 pandemic has pushed other critical global health issues into the back burner. Now, while the world has made progress in reducing the number of HIV infections, the coronavirus pandemic that has raged for much of 2020 now poses a huge threat in reversing the gains made. So what are the current challenges to fighting AIDS? And how much has COVID-19 impacted the global effort? I'm Beatrice Marshall. Welcome to Talk Africa. It has been quite the difficult year, particularly for persons living with HIV/AIDS in the world's remote and poorer regions. In the early days of COVID-19, restrictions on movement and the resulting shocks to local economies hampered access and affordability to necessary medication, thereby threatening to claw back on gains made in the global fight against AIDS. Our correspondent Hilary Ayesiga was recently in central Uganda and reports on one such case.
Agnes Nakitende is a mother of 9 and HIV positive. She makes money from baking bricks, but it's not enough to access her life-saving drugs.
The nearest government health centre from here is 10 kilometres away. I can't afford transport to the health unit. I sometimes walk, but because of the distance, I reach late when they have closed.
And she's not alone in her struggles. Nakitende is among many people in this community who are struggling to make ends meet during the COVID-19 pandemic. The Uganda government introduced tough measures to curb the spread of COVID-19. They include, among others, social distancing in taxis, which forced the owners to hike transport fees. Health workers say the coronavirus and its effects have dealt a blow in the fight against HIV and AIDS.
You remember there was a lockdown, there was no public transport. Most of the services were closed apart from a few essential services. So because of that, access to HIV services was initially affected, again, until government put measures in place to ensure that people seeking for HIV services would have to get permission to go and have refills.
Doctors say limited access to drugs resulted in some patients missing their dose for HIV treatment.
If you do not adhere to your treatment, your viral load can go up. When the viral load goes up, you fall sick as the first step, but also you are at risk of transmitting the infection to your sexual partner. So because of that, we think that COVID impacted, HIV services.
This is on top of the 1.4 million people living with the virus and an estimated annual death toll of 21,000. In order to improve the well-being of the affected people, the government has eased COVID-19 restrictions and also rolling out mobile clinics to rural areas. Hilary Ayesiga, CGTN, Uganda.
Thank you, Hilary, for that report. Now, let's get a broader perspective on this conversation. I'm now joined by Mr. Aeneas Chapinga Chuma. He's the Regional Director for Eastern and Southern Africa at UNAIDS. He's joining us via Zoom from Johannesburg. Thank you, Mr. Chuma, for joining us on Talk Africa today. First off, where are we with the fight against HIV/AIDS?
Well, there is an overall strategy to end HIV/AIDS as a public sector threat by 2030. And we had targets which we hoped to accomplish by 2020. There are so-called 390s, that 90% of those of people know their status, that 90% have access and 90% have the viral load reduced. Now, those targets have not been met for various reasons. Not enough investment in public health systems, inaction on the part of certain governments. Although globally, we have 14 countries that have, in fact, met those targets, and some of them have exceeded them. And 5 of these countries are in the East and Southern Africa region. And the onset of COVID-19, as you know, has disrupted the response in a lot of ways. And so that has affected, our capacity to meet. What has happened now is that there's a new set of targets for 2025 that are much tightly defined. They're much more focused as to who needs assistance, and much broader and nuanced in the way they approach this. So we're still hoping that we meet the global target of eliminating HIV/AIDS as a public sector threat, public health threat by the year 2030.
So before we look at the 90 targets, though, I do want to come back to what the Executive Director of UNAIDS, Winnie Byanyima, said in her statement during the World AIDS Day. And she said that goal of ending the AIDS epidemic was already off track before COVID-19. I do want to come back to your thoughts and ask, first off, how big was that margin? How big are we off track in terms of fighting HIV/AIDS?
Well, it depends on the region and on the country as well. And it is true that before COVID, we were generally off track in aggregate terms. And as I mentioned, it has to do with not enough diligence, in fact, on the part of governments in particular. And not enough investments in institutional capacities, for example, to support the response. And in some cases, there's just no inaction. And I think one of the challenges to that is also, of course, the tendency to rely, particularly in Africa, on external financial support rather than domestic, resources to support the response. And the external support can be vulnerable to various changes in the economic circumstances of the major donors going forward. So these are areas that we will need better tightening as we go forward.
So Africa's experience, when you look at over the last 30 years since the first cases were reported on the continent, talk to us, though, about the gains that had been made prior to the COVID-19 pandemic arriving on the continent.
Well, I think over 3 decades, as you know, there has been a progress, basically, in the approach. Clearly, one of the practical measures is fewer deaths, as it were, and that the capacity of those that are infected to carry on with their lives, as long as they have access to medication and they stay on medication. And, broad campaigns, basically, for prevention continuously, and attacking some of the variables that make people vulnerable to HIV/AIDS, like the vulnerability of adolescent girls, young women, the negative masculinity, and in some cases criminalization of certain acts, and the impact on certain key population groups, such as men having sex with men, etc. So it's more the treatment side in terms of access to medication in a reliable way. It's affordable. It's also the preventive measures that are ongoing, but there are things that have exacerbated the vulnerability of people, things like inequalities, gender inequalities, inequalities related to economic circumstances,
right,
that drive people and make them a little more vulnerable. So there are all these variables that all come together basically to increase vulnerability that now need to be addressed in a coordinated fashion, even as we provide basic access to medication.
COVID-19 has been quite dramatic, and we've seen the global community rallying together, for economic recovery, for instance, and also to find a vaccine and to put the pandemic in check. Looking at the long-term solutions for combating HIV and AIDS, though, what are the lessons that are being learned from the way the COVID-19 pandemic has been managed that will be helpful in dealing with the HIV epidemic in the long run?
Well, I think the lessons are more from the management of the HIV response in terms of managing the COVID-19. Part of it is to focus on communities, that's one of the lessons from HIV, that the response must be situated in communities where the people affected are. And that's what we learned from HIV. And then the other lesson is, of course, that, it has to be a global solidarity response. It cannot be a nationalistic response because the COVID-19, as I mentioned earlier, doesn't respect any boundaries. And what we see now is what we saw earlier, that when even the medication for HIV/AIDS came on board, only the rich and the able, accessed it. It took a little longer for this now to be transmitted down to poor people. We see that danger now, and I think there's an attempt to try and address this. The lesson for the future, because there will be other pandemics, I think there's general agreement, is basically for global leadership to get together and find ways of dealing with whatever pandemic from a global perspective, not from a nationalistic perspective. I think that's the major lesson going forward. And the other lesson is that we cannot lose sight of HIV. It has not been solved. It remains unresolved as an issue, as a health issue. And it's also a development issue.
Mr. Aeneas Chapinga Chuma, Regional Director for Eastern and Southern Africa at UNAIDS, thank you very much for your insights on HIV and AIDS. Well, let's expand the conversation a little bit further, and I'm joined via Zoom from Cape Town by Professor Linda Gale Becker. She's the Deputy Director of the Desmond Tutu HIV Center in South Africa. I'm also joined via Zoom by Dr. Frank Lule. He's the Regional Advisor for the HIV Program at the World Health Organization. Thank you both for being with us on the program today. Dr. Lule, Africa has fought the HIV/AIDS epidemic for over 3 decades now, but it remains one of the world's most serious health and development challenges. Talk about the gains that we have made so far. The world hopes to end AIDS by 2030, I beg your pardon. How do you rate the overall strategy to end AIDS by 2030?
Thank you very much. As a region, Africa has really made significant gains. I would start by reducing the number of new HIV infections. We are not where we want to be, but we've seen about a 30% reduction in the past 10 years. We have also seen a significant reduction in number of deaths due to HIV, and this has been largely due to the rapid scale up of antiretroviral therapy. So that is a major gain in our region, because we now have about 18 million people who are on antiretroviral therapy. That is about 70% of people living with HIV. I think that is a major gain. We have now about 80% of people living with HIV in the African region knowing their HIV status. But to me, some of the gains are usually not the numbers. It's the way our programs have matured. It's the way communities have taken control and taken leadership. And it is the way the global community has come together in partnership to address this challenge. And also the funding, which is unprecedented to really support the response. So those are some of the gains I can talk about that we have gained in the past 10 years or so.
Professor Becker, I want to get your experience from South Africa because according to reports, South Africa has one of the world's highest HIV prevalence rates at about 20.4%. We do know that South Africa also has the highest COVID-19 case numbers on the continent. What is South Africa's experience in managing the HIV/AIDS epidemic against the background of managing the COVID-19 pandemic?
Thanks, Beatrice. You know, I think I'd agree with Frank. I think we've seen some amazing progress in the last 20, 25 years on this continent, but I wouldn't let us off quite so lightly. I think there is, you know, I agree with him, there's a lot of work to be done, but I think there's some key areas where we perhaps have taken our eye off the ball somewhat. And I think some of that is the kind of health strengthening aspects. I think we still have quite fragile health systems that are very fragmented. They're not really designed for integrated care. Differentiated service delivery is not something we've really rolled out in a big way. And I think the AIDS epidemic has taught us that, you know, the key to actually ending this epidemic is to really bring integrated care forward in a way that the client is also included in the equation, and that demands really quite a lot of sophistication and quite a lot of resilience, as he has said, in our health systems. And I think COVID has shown that there are some cracks in that, you know, that when we had the lockdowns, people weren't able to access their chronic medication. The antiretrovirals were life-saving. Now, what I do love about this continent is that we can innovate. And I think we saw some real pockets of innovation around finding ways to get treatment to people, making sure that individuals could still access care where needed, introducing telemedicine wherever we could, again, task shifting wherever we could. So I do think we have the capability, but I do think, you know, this new pandemic has shown exactly where we need to still be doing the work we need to do. And I can't let this opportunity go without saying there's one particular area that I feel very strongly we will not end AIDS by 2030 if we do not eliminate the vertical transmission of HIV from women to their unborn children. This is one area that we really have within our sights. We can do this. We have the tools. And, you know, we've let it get away from us during the COVID pandemic. And this is where we've seen some regression. So I do think tightening up on our plans to eradicate mother-to-child transmission is something that we on the continent should redouble our efforts on as we move into 2021.
Well, we are going to take a short break now, but when we come back, we'll further analyze the impact COVID-19 has had on the AIDS epidemic. Don't go away.
Life moves pretty fast. Ideas move at the speed of sound. Technology moves at the speed of light. If you don't filter out the noise, you might miss the details. We pay attention to the details because they matter, showing you a different perspective. See the difference.
Welcome back to Talk Africa. Professor Linda Gail Becker and Dr. Frank Lule are still with me as we continue assessing AIDS in 2020 while in the midst of the COVID-19 pandemic. So, Professor Becker, I want to come back to your thoughts on innovation, how countries have become innovative in trying to mitigate the effect of COVID-19 against the AIDS pandemic. Now, we are realizing that some countries have reported reductions in medicine collection of up to like 20% in some areas, and people living with HIV are not getting enough antiretroviral medication, particularly during the lockdowns. Talk to us about those living with HIV and AIDS. Has the pandemic made HIV worse this year?
I think it has, Beatrice, in terms of that sort of contact, that really important contact between the end user and the health system. And that was directly because of lockdowns, and then indirectly, I think, because individuals were either confused about whether they could go to health facilities. They found health facilities were quite hostile when they did, because they were concentrating a lot on just on COVID-19, or they themselves, heard a message that they may be particularly at risk, right, and therefore chose to stay away. And I fully get that. And as a result, individuals have perhaps had a break in their treatment, reminding listeners that this is not okay in HIV. We need people to take treatment consistently. Otherwise, they can expect a viral rebound and potentially resistance within their virus. And so for these reasons, people may have broken their treatment regimen and then may find themselves reluctant to go back. There's a feeling of, well, I'm okay, the world hasn't stopped turning, maybe it's going to be okay, maybe I'm cured, right, maybe HIV has gone away. And the danger here is that people don't re-engage in care. And of course, one thing we can be absolutely sure about is their virus is going to rebound. They are going to find themselves back sick with HIV and potentially facing other opportunistic infections, such as TB, which, by the way, is also lurking, right, and definitely likely to re-emerge in many communities, many folk, because of a breakage in their HIV treatment.
Dr. Lule, talking about that disruption and breakage in the HIV treatment here, a UNAIDS report says that a 6-month disruption in HIV treatment could cause more than 500,000 additional deaths in sub-Saharan Africa in the next couple of years. Has that disruption begun to occur, though? What do you see as the long-term effect of any disruption if it is to occur?
Thank you, Beatrice. That modeling study that was done, actually, it kind of raised all our attention to make sure that this does not happen. And in the earliest months of the pandemic, in March and April, we really saw serious disruptions when we were engaging with countries. But as Linda Gay has said, communities were able to innovate and actually try and get back on track. We have not seen the devastation that was actually projected in the models, and we hope it doesn't happen. So that means we really have to make sure that we get back on track. And some of the innovations I've really seen, for example, following up of patients using mobile phones, the technology, communities taking on a bigger role. We've seen in countries where we have community pharmacies where people can easily collect their medicines. And also some of the policies that we had in place, like multi-month dispensing of drugs, which you are not actually taking, hadn't taken root. This time, most countries have adopted that. I think that is going to get us over that challenge. But what we also need to do at national level and international level is to make sure that we have the sufficient stocks that can actually make sure that all our people don't run out of drugs.
So it is a tough call, Dr. Lule, and of course I want to address the question of a cost component to treatment of HIV. There is a concern now that the time and the resources are being diverted or could be diverted to the COVID-19 pandemic. Many countries are already channeling much of their resources to containing the COVID-19 pandemic. Do you see or do you foresee a reallocation of resources that were meant for the HIV/AIDS strategy towards COVID-19? Do you think that HIV will suffer as a result?
Yeah, there is always that fear that HIV will suffer. But let me give you my experience when I was in Liberia in 2014, 2015, during the Ebola crisis. If you do not address the pandemic that we have, all programs, including HIV programs, are going to suffer. And this is what was raised earlier on, that many of our health systems are really fragmented, that we may look in a narrow way just at particular disease programs, but they are affected by those other programs within health and indeed outside health. So we really must address this COVID-19 pandemic using all the resources that we have. And I wouldn't even call it diversion. And let's not look so much in terms of dollars and cents.
Right.
The laboratories, the human resources, the programming, the information systems that have been developed over the years by the AIDS programs have been very instrumental in the response to COVID-19. So there are really components that are strengthening the response or strengthening our systems. And I wouldn't worry so much that resources are being diverted. We have seen some of our partners, for example, the Global Fund, the US government, PEPFAR, putting some funds towards the COVID-19 response, but that is for the very reason that for us to have our HIV programs running, we must address the COVID-19 pandemic.
All right. Professor Becker, the theme of this year's World AIDS Day is on global solidarity. What issues do you think should preoccupy scientists, governments, agencies, and donors, you know, on this occasion of the 2020 World AIDS Day?
I think that one of the things that really comes to mind in terms of the question you've just asked is that we don't leave any particular populations or type of people behind. And I worry a lot about those people who are called key populations. In my definition, those are individuals who are particularly burdened with HIV. So they have a high risk of HIV acquisition, but they struggle to access services, either because of laws in a country or because of ideology or prejudice or whatever. Those individuals don't easily access treatment. And this is where I think global solidarity can be very important, helping us understand public health issues. And of course, things like harm reduction come to mind, etc. So how do we move those kinds of issues forward as a global community? Because we know that they are important public health and human rights, ways to move forward. And so those are the areas that I really hope we'll pay attention to this World AIDS Day,
right? Because
I don't think we'll end AIDS if we don't end it for everyone. And that means, in the parlance of Geneva, we leave no one behind. And I think that is really important on this continent as well.
All right, we'll leave it there for the moment. Thank you very much for joining us on the program. And thank you to our panelists for that insightful discussion. Professor Linda Gail Becker, Deputy Director of the Desmond Tutu HIV Center in South Africa, and Dr. Frank Lule, the Regional Advisor for the World Health Organization. And thank you too for tuning in on this week's episode. Remember to follow the conversation online through our social media handles on Twitter, Facebook, and YouTube. And be sure to catch us again next week on Talk Africa. From me, Beatrice Marshall, and the team in Nairobi, goodbye.